Senator Fischer.
Thank you. Thank you, Senator Bozeman, for your kindness. Thank you, Madam Chair, for holding this hearing today, and thank you to our panel members. JC, you mentioned the number of cattle to people in your area. I would just say in Nebraska, we have 4 cattle for every person in the state. And I happen to come from a family ranch where we have, in my county, 30 cattle for every person. You mentioned mental health, you mentioned behavioral health. I fully understand that we are fortunate to even have our family doctors, our general practice doctors in rural areas, and specialists are few and far between, very, very difficult to come by. And Dr. Inwood, when you mentioned child care, that's difficult at best for anybody in a rural area, especially those who live on their land. And it is impossible when you live 30, 40, 70 miles to your nearest community. In my case, that would be a community of 3,000 people. So I would say I'm the member of this committee, if not in the United States Senate, with the greatest understanding of what being rural truly means in the United States of America, and especially what being rural means in very sparsely populated areas. I have a question for Dr. Henning-Smith. Great Plains Health in North Platte, Nebraska began expanding its use of telehealth to remote clinic sites before COVID-19 hit us. And while this allowed Great Plains to be ahead of the curve when dealing with the pandemic, the true value of telehealth in Nebraska is the ability to provide quality health care to rural communities. It allows doctors to provide services to rural Americans who otherwise may have to drive over an hour in order to visit a doctor. So Dr. Henning-Smith, can you tell us about some of the barriers that telehealth still faces and the value that it has for rural communities, particularly in filling gaps in that specialty and primary care, and how we can leverage technology better to address these needs?
Yes, thank you for the question. And I have to say my grandmother was from rural Nebraska. It's near and dear to my heart.
Oh,
and I
what
appreciate
area in rural Nebraska?
She was from outside of Blair, Nebraska.
Ah, okay.
Blair, Nebraska. So I really appreciate the question on telehealth, and it has the potential and already is filling a lot of the gaps in access to care, particularly access to specialty care. As you say, that's a particularly important and urgent need in rural places. We just don't have enough people to fund a specialist for each rural area. And so we need to find ways to connect patients with the care that they need. And yet there are gaps that remain, and those gaps are largely about infrastructure. The availability of broadband and a reliable connection is essential to be able to use telehealth either as a provider or a patient. And also we need the right equipment. People need to have devices in their hand, whether they're accessing telehealth with a smartphone or an iPad or a tablet or whatever else they're using to connect, they need to have access to that. And in both cases, the broadband infrastructure and the access to devices is more rare in rural communities.
Right, I totally agree with you on that. We have to get broadband deployed all across this country. For all of you, I have a question. When I'm back in the state, which just is about every weekend, what I'm hearing from Nebraskans is their concern about inflation and the prices of food and the prices of gas. That is the #1 concern. It has been for many, many months, long before Ukraine situation that we're facing. But it is a deep concern for families across the state. So do you have concerns that inflationary pressure on essential products like food could have impacts on the health of rural families as as their incomes are continually squeezed by these higher prices? And also, how has the high cost of gas impacted people living in rural communities? Do you have concerns that that is going to affect their decisions on if they can even afford to drive many miles to access that health care? We have family practice physicians in the community closest in my county, but for any kind of specialty, it is about 130 miles or more to be able to reach a specialist. So with food, gas, if I'm asking the indulgence of the committee chairwoman, if we can quickly, you know, kind of hit on the stresses that families face.
All right, if we could do this quickly, important question, but we'll do this quickly. Thank you.
Thank you very much.
Okay. Well, first of all, thank you so much for the question. And we have a lot of families from Nebraska and farmers from Michigan who've also been very helpful in us understanding what these issues are. The issue of being able to get to work in order to have enough money to pay for all of those essential services like food and rent, which you alluded to, is critical. And childcare is what enables families to get to work. When we hear about the distance of farmers driving up to 30 minutes for childcare providers, that exactly is a stress. And so we need to think about how can we do more childcare and provider training within communities, whether it's home-based care or more localized cooperatives, that can alleviate some of those additional stressors of driving.
Thank you for the question. As a community mental health center, it's our expectation to get the service to the person in need. So we are actually taking the iPads to people's residents so that they could access care from home. We're also experimenting with trying to get providers into more communities, and we've purchased 3 tiny homes in the last 3 years. And what we do is we deploy those tiny homes into those communities to try to get access to care closer to those people and where they live. And the ability to use those tiny homes allows us the mobility to move those community to community and try to embed those services closer to people that may not have the means to come to the city for care.
Well, I certainly don't think you should ask the economists about people's mental health, but we do know from lots of survey data that this is the #1 issue across America, and there's no question about that. And we also know that people are not optimistic about dealing with it quickly. One of the striking things in the data has been the rapid rise in inflation expectations from under 3% in January of 2021 to over 6% now. So it's not that they feel stressed at the moment, it's they feel stressed for
kind
the
of across the
foreseeable
board.
future. That's
Yeah.
the concern.
No, thank you.
Thank you, Madam Chair.